Hello and welcome to Nature Source Care. My name is Dr. Funda Goldman. I'm a naturopathic physician, and in today's talk, I was going to cover homeopathy for repeating the same mistakes, or specifically the Bach Flower remedy chestnut bud. Also, I just wanted to say, I appreciate all the support that people give to my work. And my videos and my channel. It's all very much appreciated, whether it's subscribing to the channel or giving a like or a nice comment, or some people offer quite generous donations. So it's noted and it's appreciated. So thank you for that. Before we get started, the information presented here is for educational purposes only. It should not be considered medical advice. For any symptoms that persist or worsen, please consult with a qualified medical professional. It's always best to determine the root cause of any disease and to develop a comprehensive treatment plan, of which homeopathy or Bach flower remedies can be a part. But while homeopathy or Bach flower remedies can be very effective, they may not be appropriate for everyone or as a single therapy. So please keep that in mind. All right, so today's remedy, chestnut bud. A few words about homeopathy generally, Bach flowers, if you're not familiar with them. I have a lot more background history on Bach flower remedies and homeopathy in my first Bach flower remedy video, Walnut, so you can see that. But the general idea here is that Bach flower remedies and homeopathy are a type of energy medicine. And so the general concept is the disease stems from an inner struggle within the being. And what I find in my practice is that these happen to be very effective most of the time for mental, emotional, and spiritual conditions. So things that are more kind of subtle, difficult to touch, or kind of get at, and things that don't necessarily, fall into neat categories like DSM categories, like, oh, this person's clearly ADHD or this person's clearly bipolar or something like that. It's kind of the more subtle stuff that people deal with in the day to day that may not actually get the full label of like pathology or something like that, something that kind of deep, but still is a problem nonetheless, in people's lives. So, and anyway, with chestnut bud, the keynote here is that the person keeps ending up in the same negative situation. Yeah, and so the inner state of being is that part of the reason why they end up in the same negative situation over and over again is that they do not seem able and or willing to deeply reflect on how they participated in creating the negative situation. And because they don't do that, they don't actually change and grow to create better outcomes for themselves. So that's the issue. So let's look at this. I mean, chestnut bud is, well, they're all, all the flower remedies are interesting, but this is kind of a little bit more even nebulous than many of the Bach. So, person that you might be thinking about or faced with, or maybe within yourself, although if this is within yourself, you may not be reflecting, you're probably not reflecting on these problems. So that's part of the issue. But the person in that we're looking at is that they tend to lack deep reflection, integration of any sort of insights that come from deep reflection. So again, they can't kind of grow and develop and mature. Um, and the reason why they may not be deeply reflecting is it might be fear, it might be just lack of interest in thinking about it. It could be, lack of responsibility, like not thinking, oh, maybe I'm part of the problem. Maybe I'm the reason why I keep ending up in this situation. That might be it. I think it could also be on other levels, like maybe their self-esteem, like maybe they can't handle self-critique. Or maybe they're just like, even though I end up in this negative situation, it is what it is. I am what I am. It's not that bad. Maybe they don't think it's worth self-reflecting. It could be something like that. Or they don't feel like they deserve a better situation. So they just kind of keep, putting up with the same thing over and over again. And that's part of it too, is that typically people in the state don't seem particularly concerned. Maybe the people around them are like, oh, there they go again. And maybe even they're like, oh, here I go again, but they don't seem like that concerned, enough again, and motivated enough to do the reflection and the integration and growth and all that sort of thing. So it's a little bit odd. It may seem like they may come across as like they don't really take themselves very seriously, like not seriously enough to, dig deep within themselves and pull up some insight and make some changes, internal changes, so that the external situations change. They can often have like a naive or ingenue quality to them. And despite the fact that they might be older, actually, most of the people that came to mind who kind of have this thing going on are people who are older, like even like 60s, which is, also kind of odd. I guess for me, and some of these people I know, through my practice, and some I just know, like, in the world. Um, and they always kind of struck me as a bit odd because, especially when they're older, because I'm like, yeah, I guess in the past, I used to think, oh, they've been on this planet much longer than I have. They have more life experience. They're gonna really know what to do, to take care of their business situations or whatever. Like I should be learning from them almost. But no, there's plenty of them who are older who just um they keep ending up in the same kind of negative situations. I mean, one woman I know from my practice, she had diabetes really, and was a businesswoman and very astute businesswoman and that sort of thing. But it was kind of funny. She had the skill set. I guess that's what was kind of, a little bit tough for me to understand. It's like she had the skill set of being able to, and was very much on top of her business in terms of, if something was not working out, she could like go deep into like the accounting and that sort of thing and figure out what the problem was and dig it up and remedy it, and, so that the business got better. But in terms of her personal self and health, that skill set did not transfer. So, we talked about, especially with diabetes, we talked a lot about nutrition and exercise and stress management, and she kind of kept coming in appointment after appointment, and I did actually give her agrimony, Bach Flower, because she was the type of person who was always smiling and sort of cheerful, but in a way that you kind of felt deep down wasn't really true for her. And that was the case. She was in a relationship where she was not very happy and was sort of making an exit plan, but it was a long-term exit plan, like it was going to be years before she left the situation or the relationship, and it caused her a lot of stress. And so the stress would come up and it would throw her off course in terms of all the things we talked about with like nutrition and eating balanced meals and high protein and getting proper exercise and stuff like that. So it's just, it was hard to figure out how to get in there to support her and help her. And so we would talk and she'd go off, but then she'd come back and not really make any progress. And, at some point I asked her if it was if it was helping her for her to come in. Because sometimes people come in and it's almost like a check-in, like, okay, I have to report to somebody. And so they kind of like, just for that reason, like they kind of make appointments so they have somebody to check in with and keep on track and stuff like that. But even with that, she would kind of come in and she'd sort of smile. She's like, "Well, at least I'm not eating Nutella for breakfast anymore." And I was like, "Yeah, that's an improvement." But her numbers went down initially when she was doing a little bit more, but then she kept coming back with reasons why, mostly because of the relationship, that she wasn't staying on track and doing things. And it was so anyway, so yeah, I guess I had that conversation with her, and maybe that woke her up a bit because then I did get some information from her that she was doing better with like exercise and stuff like that. But we haven't checked on her numbers. But that's a kind of, dynamic that it can be tricky. And people that I know more personal on a personal level, again, they tend to be older. Like the woman I mentioned with diabetes, she was in her 60s. I mean, she's and and then this other woman I know, she was also in her 60s, and uh, she just she kind of needed somebody to. That might be a different situation, but she kind of ended up in the same thing, same situations over and over again, and kind of needed to talk about it a little bit, but never really dug inside of herself to see how she could shift and change things to create a different outcome. So it's just like, oh, this happened again. Oh, it's a bummer. Oh well, like it's um yeah. So I found it difficult, and again, in the personal situation, it wasn't appropriate for me to bring up chestnut bud, but maybe it would have. um yeah, and that's the thing is like, again, it gets at this like, what I was wondering was I did tend to notice, especially with women who'd been married young, and maybe went directly from their home, like with their parents, to living with a spouse or something like that, and didn't have much, if any, time on their own. I found that this kind of dynamic um, presents itself more often. And maybe it's because, their life is not bad enough, or the situation is not bad enough, where it really is like, that shock and awe you need, to get yourself moving. And it's like, I got to do something here. Or, there's enough people around, whether it's a parent or a spouse or whatever, to sort of buffer, the effects. Like maybe the parents always just kind of cleaned up the mess, or the spouse always kind of cleaned up the mess. And like, um, maybe so again, maybe the issues were never truly addressed. And the thing is, then the person doesn't develop the ability to self-reflect and take responsibility, because it's like, if somebody's always kind of buffering things for them and the fallout from these negative situations, then again, they are not motivated enough to go there. So anyway, again, those are just personal th when I was going through this remedy, those are just personal thoughts I've had with different people that I've known. And again, just trying to get at the deeper insights of this remedy and this dynamic, because again, with Bach Flower remedies, the magic happens when you find the right remedy. And so to really dig deep and to really parse out what's driving this person and matching that with the appropriate remedies is what makes it work. Or at least gives it a chance to work. So, yeah, so personal. So, it can also kind of look at like the grass is always greener, that type of mentality where it's like, oh, another relationship didn't work out. Oh, well, I'll just go back on a dating app and, find somebody else, as opposed to, wow, why do I keep kind of meeting the same person and having the same dynamic? Like, what do I need to change within myself? Maybe I need to set different boundaries, or, whatever, to create a different outcome. So again, that grass is always green. It's kind of like, oh, we'll just like wipe the slate clean, and start all over. But without really truly changing the internal approach. It's just like, oh, it's just, again, circumstances, it's a circumstances or person or whatever. So if I just hit the lottery and get the right person, things will work out. But they're not, again, looking deep within to see what they may be doing. Um, and it can, kind of, I sort of mentioned with that one woman, like, in the clinic, a clinic situation, I often find with people, it's like they might make the same food choices and choose foods that they know are not good for them, cause digestive upset, or, changes the way their mind works or whatever. But they keep choosing those foods. And so you also have to kind of, figure out if maybe there's like some sort of addictive situation. That could also be, you know, that might have kind of a similar uh, outlook, or presentation. So again, you have to dig deep to figure out what's really driving this person. But again, if it's more of this sort of like naive, sort of like, oh yeah, that happens. Oh yeah, well, we just try it again. That sort of thing, then maybe chestnut bud would be appropriate. So the risk of not addressing this problem is that, again, the person became stuck in the same problems and situations and an immature state within themselves. And then the other thing is other people around them might get tired of supporting them because it's just like, oh, you keep ending up the same relationship, and I'm kind of tired of hearing about it. And you're sort of not only wasting your time getting into these relationships, but you're wasting my time because I have to hear about it, and I choose not to hear about it anymore, that sort of thing. So, um, the potential outcome of taking a remedy like this is that there would be deeper consideration and self-reflection. Maturity, right? There would be progress in the emotional maturation of somebody. They would take more responsibility for themselves. Some people take too much responsibility for themselves and they're like, what did I do? What did I do? What did I do? And, they always assume responsibility when sometimes it truly is the other person or circumstances and they didn't really do anything. Sometimes it's just a matter of timing, the stars didn't align or whatever. It wasn't meant to be. That is true. But when somebody habitually, chronically does not self-reflect or look at, digging within themselves to figure out how they should shift and grow and adapt to create a better situation for themselves, that's the problem. So self-development would happen, self-growth, self-actualization, improving confidence, um, and getting grounded. So again, there's this sort of like, I think that's why this state of mind is hard for me to access because again, if they don't even see it as a problem, they're not motivated to really do anything about it. So it's sort of like, I might ask a question or two, but they're like, yeah, that's just sort of the way it is. Then it's sort of like, well, okay. As a practitioner, what am I supposed to do? If they don't see it's a problem and they're not really complaining about it, then then it's hard for me to help them because I don't want to. It's not appropriate, I think, for me to be like, aggressive, like, oh, well, this is a problem. I know you don't see it as a problem. Yes, that doesn't seem right. So anyway, yeah, this one's a little bit slippery, tricky. They would become more grounded. So it's like there is this like connection between their internal world and process with actually creating different results in the outer world, more adaptable, actual progress within themselves and their internal and external life, and a better connection, I think, with others in life in general, rather than sort of floating around like these people I mentioned who were like older, who were, kind of still in this state. Yeah, I actually sort of wondered, like, how did they sort of manage like all these, decades of this is sort of, mentality and um, I'm like, wow, I guess maybe they were just lucky or, or even lucky to have people around them who kind of buffered them from any sort of fallout, I guess. I don't know. Again, very mysterious in some ways, at least for me. But if they do start this, they'll connect more with life and potentially, navigate their way through life more effectively and other people too. Like it's hard to connect with somebody who's kind of this sort of in their little bubble like this a little bit. Because most people are trying to figure out how to move forward and, there is some level of self-reflection. So it's hard for them to connect, I think, with other people. Other people might kind of again, the dynamic may be again this almost like parent-child thing or caretaking role that other people have where they're like trying to, you know, um, keep them from going too far off the rails or something like that. Um, and some people need that. But there are other people who seem like they should be capable of it, but it's still not happening. So I think that's where you might consider chestnut bud. Other remedies, because again, the nuances of these remedies are what really, I think, is the critical step for finding, when you find the right one, it tends to work pretty well. So there are other chestnut remedies. There's sweet chestnut, which I have not covered yet, but white and red I have covered. So white chestnut is more about overthinking and not being able to move forward because you're overthinking. So this is almost the opposite of chestnut bud. I mean, these people are thinking so much they can't move forward because they never move beyond the, self-reflective processing, mental processing stage. And then red chestnut is for excessive fear-based caretaking. So when people are caretaking so much, but again, it's fear-based, you might consider red chestnut. So just don't confuse the chestnuts because there's four of them, four Bach Flower chestnut remedies. Clematis is another remedy to consider. Clematis is sort of similar where I think of clematis for people who are like artists or absent-minded professor types or like kind of nerdy intellectual types and stuff like that. But the thing is that the again the deeper issue is separate. With clematists, it's like those folks find the ideal world more interesting and engaging than the material world. So they're just sort of like, it's not that they don't self-reflect, but they're kind of just much prefer the ideal world and they kind of float around there like a little bubble. So there is a little, it seems similar, but it is actually distinct. So clematis might be another one potentially. Also, remedies that I've covered, like it could also be not trusting intuition. So Cerato and Larch are in that kind of general category. Cerato is more for people who don't trust their intuition because they trust the intuition of others and other people's opinions more than their own intuition. And so instead of following their own intuition, they'll follow what other people say and they'll get lost and set off track because they're following other people's thoughts rather than their own. So again, that's a different thing than chestnut bud and larch. Larch people, they often don't move ahead in life or progress in life because they don't give themselves a chance to, because deep down they don't feel like they are on the same level of others. So this is kind of more of a self-esteem based, like not progress, no progress being made. But again, it's not that large folks aren't self-reflecting, but they might self-reflect and think, oh, I could do this and this and this, but then they won't move forward because they don't feel like they're worthy of it, of like a higher job position or a better relationship or something like that. So those are possibilities. And also remedies for neediness. So I have other videos on chicory and heather. I think those are in the same video actually. Chicory is the needy mother. So this is more, whereas red chestnut is about fear-based caretaking, chicory is about control-based caretaking. So this is like, not just moms, but the helicopter parent who kind of needs to be in control, and there is often this element of like you owe me, like because they maintain their sense of control and status and relationship and kind of keep people under their thumb by always doing things so that people owe them. And so it's yeah, there's that dynamic potentially. But more than that one, when we're talking about chestnut bud, you might consider heather. Heather is like if chicory is needy mother, heather's needy child. And heather people can show up as sort of like talkative and talk about the problems and stuff like that. And part of it is like the attention seeking part of it, because they didn't really get that when they were growing up. Um, and so, they're externally processing to get some attention. But again, it's not that they don't self-reflect and that sort of thing. But again, the deeper need um, for heather is different than the chestnut bud. Yeah. So again, all about subtleties here. So there you go. Chestnut bud, another one of the chestnuts. I guess we've got one more chestnut to do and a few other Bach flowers, but we're making our way through the list. As always, I want to thank you for your time and your interest. I hope you found this interesting, helpful, useful, um, as you navigate your way forward. So until the next one, take care. Namaste.